Hi, I'm Dr. James Main. I'm the pioneer and developer of the magic technique and author of this book, Gagging for It. So we have just conducted a 100 Gaggers survey. It wasn't conducted by myself, but it was done by a marketing company called Roots, which is an independent marketing company. Basically, what we've done was to send out a questionnaire to 100 gaggers who were checked out that they were suffering with hypersensitive gagging. And then after the questionnaires were done to assess how bad their gagging was, we then sent them out this book, Gagging for It. They read the book and put it into practice, and then we then followed up with a second questionnaire about 3 weeks later. The results were quite outstanding. If this was a drug trial, I think we would all be absolutely amazed. In a nutshell, the headlines are that of the 100 gaggers, 58.3% actually found that their gagging had significantly diminished or gone, which is almost 3 out of 5. Furthermore, about 73.6%, which includes that 58%, said that their gagging had improved. So that's almost 75%, almost 3/4 of the cohort suggested that the gagging had improved in some way or diminished or gone. We were also found that another significant stat was that of the 100 gaggers, only 12% of them were able to brush their teeth at the back in particular, whereas after reading the book, 98% of those that improved could brush the back of the teeth without any problems. And this improvement was independent of whether the gagger was a severe gagger or mild. Just by reading a book, that made the difference, which really is quite incredible in my mind, because what was a real take-home message as well was that 90% of those people that took part in the survey has had this hypersensitive gagging problem all of their lives. And so what we're really seeing here is these people who have had an entrenched lifelong issue with hypersensitive gagging, unable to brush the backs of their mouths. Many of them weren't able to wear tight clothing or found it very uncomfortable going into crowded spaces. Just by reading a book, they were in effect cured, in inverted commas. Now, this is not a randomized controlled trial. This is not the sort of gold standard that I would now seeking to undergo in a clinical setting. But it is outstanding that, 100 gaggers, just by reading a book, can see such an improvement. So the thing here is that what we're doing now is we're going to put out to the public, because this isn't a pill, this isn't a tablet, this isn't a drug, this is simply a self-help book which is going to sort out for the vast majority of hypersensitive gaggers their gagging problem, and allowing them to attend the dentist, brush their teeth without gagging, be able to do things which they weren't able to do before, because some of the comments we had were quite outstanding. Swallow tablets without gagging, be able to go into crowded areas where they weren't able to do before. Like one person mentioned that they went to a housewarming party, which they probably would have avoided in the past. Be able to wear clothing around the neck, whether it's polo necks or tight clothing. The thing about the 100 Gaggers survey is that it highlighted so many things that improved people's well-being and quality of life, some of which we didn't even know ourselves. So what I would say to yourself, if you're watching this, is that go and do a toothbrush test, which is on our website, www.agm.care. That stands for the Abolish Gagging movement. And see how it's done, and have a go and see whether it has an effect on you. And if it does, get the book, go through it carefully, follow what it says, and see how it'll improve your quality of life, which is what this is all about.